everyone. It's been a little while since I've done a video with some updates. Excuse me. So I thought I'd take today. Well, I have a little guy here who's busy watching a video on the screen right behind where I'm doing the video. And I've had a number of comments on the last couple of videos I did concerning the possible tic disorder with Deacon. And I thought that I would give you an update per your request on what's been going on. I'm going to turn this down. I get very distracted with noise, so he's just going to have to watch the video here. Yes, this is Deacon. Yay! Yay! He's doing great. He is now almost 1 year. He'll be 1 year in 1 week. And he's quite firecracker. Oh yes, he is. He's all ready for his first birthday. Anyway, I wanted to get to the main points. So don't mind him interrupting. He just wants to have a say. So he had an EEG done a couple weeks ago, probably about 2.5 weeks ago. And my daughter happens to work for the medical center where it was done, so she was able to go onto the portal system and get the results the very same day. Of course, trying to read the results is something entirely different, but basically what it concluded was that it was essentially normal. Yeah, I know, essentially normal. So that's like normal, but so she had to send a note off to the pediatrician to get her to take a look at it, and because it talked about there were several artifacts that caused it to have that reading, and it had just a lot of radiological mumbo jumbo on it that it was hard to understand. So the pediatrician came back and basically what these artifacts are movement. Now my daughter was a little perplexed because during the EEG, and I'm going to post a picture of what he looked like. He was all bandaged. You'll see in the picture he's all bandaged up because he had the leads on his head. But he was very, very quiet during the whole time. He wasn't moving around. He wasn't jumping. He wasn't even doing this kind of stuff. He was basically watching videos on an iPad. So my daughter was confused because he was very, very still during this. I think it was like they did a reading of about 40 minutes, 35 to 40 minutes. But actually what it turns out, artifacts could be any kind of movement. It could be as simple as eye blinking, jaw clenching. Yeah, he's getting bored. And jaw clenching is something he does. He grinds his teeth that he's gotten in quite a lot. So obviously he was doing it, even like yawning or smiling, anything like that can interfere. Muscle movement is picked up on an EEG about 100 times greater than electrical currents. So we didn't really tell them much other than the pediatrician assured her it looked good, but that she still wanted him to see the neurologist. So that's my next point. He did see the neurologist last week, and the neurologist assured her that it was a normal EEG. He probably could have done a longer one because they had to rely on what they had in between these artifacts or these movements that were picked up on the EEG. So, but he did get a diagnosis. The good news is it is not seizure activity. So, thank you, Lord. That was the main thing to rule out, that the pediatrician wanted to rule out, was that, just to be on the safe side, that this was not any kind of epileptic seizure activity going on. And she said it was not. These were motor tics. And that she being the neurologist, commented that he is abnormally young for motor tics such as this. He's not abnormal. Motor tics in a child his age is abnormal. Not unheard of, but it's just not commonly seen. So his actual diagnosis that he got, I'm going to read it right from here, is shudder attacks. That's a shuddering that he does, kind of like he's chilled. Shudder attacks abnormal motor tics congruent with palliative pain. Now, I didn't mention it. I don't think I mentioned it in an earlier video, but if I did, forgive me. But I know I did in a comment to somebody who had said that they were experiencing something similar in their family. His daughter and I had noticed that his tics seem to be very prominent during times of teething. It's very obvious when he's teething. He drools mostly, is how you can really tell that he's always he chews on everything. I've got bruises on my arms, cuts on my arms, and my daughter on her hands where you accidentally get in his way. And he just chews, doorknobs, anything that is his height, he chews on. So the doctor, I kind of lost my train of thought there, but we had noticed that, whenever, he seemed to be really at his peak of teething, the tics were much more prominent and frequent, as opposed to in between, when right after maybe he cut a tooth or two, and you're going to see these slight little shuddering and tics going on. They were not quite as bad. And so basically the neurologist just concluded what we already suspected, that the pain was triggering these tics that he was having. I'm trying to give him make sure he has a chew toy, something to chew on. He's not too interested. Let's see. How about a binky? How about your binky? There we go. Okay. Anyway. So, on one hand, yes, it's very reassuring, because it's kind of what we already knew, and there's nothing you can do about it. But it was comforting to know that what was going on was not seizure activity, that these are abnormal tics, but they're brought on by the pain. And the neurologist went on to explain, and I'm going to paraphrase in my own words, not medical words, that his myelin sheath, that is around the brain, is where the neurons are moving. You know what I'm talking about. But anyway, this is how he's processing the neurons firing during pain. Some children, experience a lot of pain, and they'll do crying, and they'll do a lot of drooling, or they'll have a fever, or they'll have other ways that they manifest teething, that they're teething, and it's very uncomfortable. They're in a lot of pain. How Deacon here processes the pain are the tics. Now, I'm not going to try to move my head like that, because I try not to get him. I don't want him to mimic anything that I'm doing. So what is happening with these synaptic firing things going on in his myelin sheath, which is not fully formed, not at his young age, is he's manifesting these tics. So moving on to finally, basically, and I'm going to try to get some of these continuing tic pictures in the video, the final video that I'll post on YouTube. So the final point that I wanted to talk about, as I just mentioned, is what you may be asking now. Okay, what do you do from here? What happens now? And really, as far as the neurologist is concerned, there's nothing more that she needs to do for him. There's not even a follow-up required, unless, of course, he would develop something new that seemed neurological, not just a new tic or anything like that. So he just doesn't have an appointment. He won't be seeing any other specialist for now. He'll just continue on with his pediatrician, who will follow along. But as far as the neurologist did say, I'm sorry, I'm stumbling over my words. She did say that more than likely he will, around the age of 4 or 5, they can expect to see the tics occur. Regular motor tics, maybe he had stopped for a while and they'll pick back up again. And the reason for that is tics, they say generally tics run in families. or in the family. It's a hereditary thing. Deacon's brother has had a tick for quite some time now. His brother is 15 years old now. That's a big age difference. Deacon was a surprise baby. Anyway, when his brother developed his first, well, he was about 5 years old, and he, as I said, he's 15 now, and he's on his last tick. Now, you may say, what do you mean on his last tick? That's I've never heard that before. The understanding from the explanation from his pediatrician was when a tick starts in a certain area of the body, if it starts lower in the body, which for his brother it started in the groin area, the ticks will work their way up. It'll go from tick there, and it did, to he developed a hip one, and then kind of a chest one, then he did the shoulder shrugging one. And then it went up to the head bob kind of tick, sort of like Deacon does now. And he's finally on the last one of the eye blinking. So after that, it most likely will just go away, which is what we're hoping for Deacon. So they said that they won't diagnose it before that. He has to be, his developmental stages have to advance. I mean, the myelin sheath has to continue forming along with other areas of the brain that are always, developing along from a toddler, infant to toddler to, on up into the preschool, elementary, and so on. That you have to allow for that. Plus, there's criteria that you have to meet to get a tick disorder, other than the tick disorder that he's having right now, which they're saying is indicative of the pain. There's simple ticks, there's complex ticks, there's the motor ticks, vocal ticks. The guy's getting a little tired. Anyway, so you have to meet certain criteria of so many types of your one type of tick or multiple ticks, one or more of the motor ticks and the vocal ticks. There's a whole criteria in the medical field that they must meet, and so they won't even look for that till approximately the age of 4 or 5. So that's where it stands for Deacon right now. So as I said, Deacon turns 1 next week, so happy birthday to Deacon, and he will continue on probably as long as he's teething to have the motor ticks. He's already developed a new one, which is a single shoulder shrug, but I wanted to put this out there to let you know. Feel free to leave your comments, your questions. I can't give any medical advice. I'm not qualified to, but I can certainly share my experience or any more in-depth questions that you might need answers for. That would be absolutely fine. And I thank you so much for listening to these videos, and I hope that they've been helpful. Do you want to say bye, Deacon? Say bye. Bye. Look. Say bye. Bye. Thank you so much. Bye-bye.